Thank you all for joining us this evening. My name is Alphonso David, and I'm the president of the Human Rights Campaign, the largest lesbian, gay, bisexual, transgender, and queer civil rights organization in the nation and around the globe. A little over a year ago, the World Health Organization declared COVID-19 a pandemic that led to an extraordinarily challenging year, a year where each and every one of us have experienced loss. Some of us lost loved ones. Some of us have fallen ill or are still recovering. Some of us lost our jobs or taken on multiple jobs to support our families. It has been a year that has truly tested our resilience and our resolve. And it has been a year that has laid bare the systemic inequities facing LGBTQ people, particularly transgender people and LGBTQ people of color, which must be urgently addressed in this nation. This year, 2021, we do have hope on the horizon. Because our communities came together like never before this past election, we now have new federal leadership committed to protecting the lives and welfare of people they serve. And with 3 safe and effective vaccines approved by the FDA, we are that much closer to being able to safely get back to work, to school, and to gather in person again. But for us to do so, we need to make sure that we have the information and infrastructure we need to access the vaccines and to comfortably use them. To begin, we first need to address medical distrust in many of our communities. In a research brief released last week by the Human Rights Campaign, we found that some members of our community were hesitant to take the vaccines, particularly LGBTQ Black people and bi+ women. These concerns are no doubt fueled by past and present challenges when it comes to accessing and receiving care, particularly care that treats us with dignity and respect. As we acknowledge these challenges and work to address them, I submit that we should be guided by one principle: making sure that no one in our communities is being left behind. That is why the Human Rights Campaign has launched a public education campaign for ourselves, for each other, getting to the other side of the pandemic. This campaign aims to communicate the facts and latest information about the vaccines, as well as address communities' concerns. At tonight's town hall, you will hear from doctors, experts, and community leaders, including Dr. Anthony Fauci. We're grateful to these leaders for joining us this evening, and we're grateful for you for being here. During this time of extraordinary challenges, our community has inspired us, sustained us, and supported us. As we look to a brighter future, we must ensure that all members of our community get the support they need to enter this next chapter, poised to thrive. Now, I'm pleased to introduce J. Maurice McCants-Pearsall, the Director of HIV and Health Equity for the Human Rights Campaign, for a conversation with some of the leading minds in our country on the pandemic, its impact on our community, and how to stay safe.
Thank you, Alfonso. It is a pleasure to be with you all this evening, and thank you for joining us. I'm now honored to introduce tonight's distinguished panel of experts. We have Gabriel Maldonado, the founder and CEO of True Revolution in Riverside, California. True Revolution is one of California's leading LGBTQ, minority-led and serving community-based organizations who provide HIV, mental health, and housing services. Gabriel, thank you for joining us today.
Thank you for having me.
Also, we have Dr. Jen Cates, Senior Vice President and Director of Global Health and HIV at the Kaiser Family Foundation, where she oversees policy and research focused on the U.S. government's role in global health, including and domestic HIV epidemics. Dr. Cates also serves on numerous federal and private advisory committees on global health and HIV. Thank you for joining us, Dr. Cates.
Hi, it's good to be here.
And then last but certainly not least, we're joined by Dr. Oni Blackstock. Dr. Blackstock is a primary and HIV physician and an intersectional equity advocate with expertise in racial, gender, and LGBTQ equity. Founder and executive director of Health Justice, whose mission is to help healthcare, public health, and other organizations center anti-racism and equity in their workplace culture. And she reducing health inequities in the communities that they serve. So thank you for joining us, Dr. Blackstock.
Thanks so much for having me.
So let's begin the conversation with Gabriel. We've received hundreds of questions from HRC's members and supporters. But before we start answering those questions, Gabriel, as a leader of a community-based organization with a particular focus on LGBTQ health, what questions are you getting from the community members that you serve?
Well, thank you again, Jay Maurice, for having me. And, if I can just be very candid, the kinds of questions I'm getting are the basics on how do I survive? And I think right now, from housing instability to food insecurity to mental health disparities to unemployment, I think people are just trying to grapple with some of the basic fundamentals of survival. In particular, I've really seen that a lot of people had a whole host of pre-existing conditions prior to the pandemic beginning. And so there were a lot of surgeries and operations and procedures and therapies and treatment plans that were very much put on hold for a great number of people. And I think what COVID has done is it's really shine a light on some of these other weaknesses and deficits in our system that have caused a whole host of exacerbated issues under COVID-19.
Thank you for that. I'm going to kind of spin off of that question a little bit. And my next question is for Dr. Cates. Dr. Cates, new research released by your team at the Kaiser Family Foundation gives us additional insight into the LGBT community sentiments and experience during the pandemic. The research also provides us insight on what's driving LGBTQ people to get vaccinated and how that might differ from our non-LGBTQ counterparts. I'm interested in knowing what's driving members of our community to get vaccinated.
Yeah, good question. We were able to do a nationally representative survey of everyone in the United States, and included in that were self-identified LGBT folks. And we asked a number of questions about COVID. We asked about getting vaccinated, and we found a couple of things. One, that LGBT individuals were just as likely to say they wanted to get vaccinated or not as everybody else. However, when we asked why, what motivates you, why do you think vaccination is important, we found that 75% of LGBT adults said that it was part of everyone's responsibility to protect the health of others. That compares to 48% of non-LGBT adults. So a much bigger share of our community feels like this is a responsibility that we have to others. That's a pretty striking difference.
Right. And that's kind of in correlation with some of the work that we've done here at HRC, some of the data that we found. So last week, we released research that shows that some parts of the community are more hesitant to be vaccinated than others. We also learned that, less than 1/3 of the Black LGBTQ community and the bi+ women say that they are unlikely to get vaccinated. We also saw that members of the community continue to face extreme economic consequences as a result of the pandemic. So what else does the research that you've released tell us about the impact of COVID-19 on LGBTQ people?
Yeah, I want to highlight two other findings that are pretty important and striking. First of all, we found that LGBT people said that they were more likely to say that they or someone in their household had experienced job loss during the pandemic. 56% compared to 44% of non-LGBT people. So that's significant. And then secondly, much more likely to experience mental health challenges during the pandemic. 3/4 say they're worried and stressed from the pandemic, and it's had negative impact on their mental health, and that compares to just 49% of non-LGBT adults. Obviously, the whole country has been, traumatized by this, but our community has been hit pretty hard.
Yeah. And we definitely see that impact across the community. Let me shift gears for a little bit. Dr. Blackstock, as our resident physician on the panel, I need your help answering a few medical questions from our members and supporters. These questions are going to come quick and fast. If you don't mind doing a lightning round with us, are you okay with that?
Sounds good.
Okay, great. So here we go. I'm going to ask the first question. Oh, I'm sorry. My screen went away. So the first question, why should I get vaccinated?
Okay, so just want to first just say thank you so much for the invitation to be part of this wonderful panel. And also to say that, I'm here, I have my hat on as a physician, as a healthcare provider, but also as a self-identified Black queer woman. So I understand many of the concerns that folks watching might have. So some of the reasons to get the vaccine are, one, it prevents people from getting COVID-19. We know that in this country alone that, many people, millions of people have been impacted by the coronavirus. Many people have become infected. Many people have lost their lives. People who have recovered from infection with the novel coronavirus often have long-term side effects. So a vaccine can help protect the individual. And then I think just thinking about what Dr. Kate shared about this sense of like collective responsibility that seems actually more common among the LGBTQ community is that it can also protect, other people from getting infected, particularly people around you who might be particularly vulnerable, who may have underlying health conditions. And then also can get people back to doing a lot of the activities that they really enjoyed doing pre-pandemic. So those are some of the reasons why one might want to get vaccinated. Oh. I can't hear you. Oh, Jay Maurice is muted.
Can you hear me now?
Perfect.
Okay, great. Sorry. Our second question is, if I had the virus, do I still need to get vaccinated?
Yes, the recommendations are that even if someone has had COVID-19, that they still get vaccinated. And the reason why is that we are not sure sort of how long, natural immunity lasts. And we know, so protection from when someone has an infection. We do know the vaccine appears to provide maybe added protection. It seems to have a more robust immune response as compared to when someone has a regular coronavirus infection. So yes, the vaccine sort of boosts and ups the protection that one might have even if they've been previously infected.
So we know that there are current three vaccines on the market right now. So one of the questions is the Johnson & Johnson vaccine as effective as the others, and which one should they pick?
Right, so whatever is offered to you, whatever is available, I think Dr. Fauci will say this, take it. All of the three authorized vaccines here in the US are all highly effective at preventing severe illness, hospitalization, and death from COVID-19. And those are really the outcomes that we care most about. And any differences in effectiveness or efficacy that people may have heard about are likely related to the fact that these vaccine trials happened at different times. The Pfizer and Moderna trials happened before the emergence of some of the more concerning variants that the audience may have heard about, such as ones that were first detected in South Africa, for instance. Some of the trials were conducted for the Johnson & Johnson vaccine in South Africa, and so was affected by the emergence of these variants. But just to say that they are all highly effective at preventing some of the worst outcomes from COVID-19.
Thank you for that. And I guess another question that we have is, will I need to get a booster? That's a question that I had for my physician, so I'm interested in hearing your answer.
Yeah, I think it's like a TBD, right? Like we don't know yet. I think that's what's being studied right now. I think, folks are familiar with the flu vaccine. And so each year the flu vaccine is updated to cover like the most predominant strain or variant. And so there may be something similar that's required for COVID-19 and that's being studied, and hopefully we'll be finding out soon.
Okay, and the last question. Will the vaccine protect me from variants out there?
Mm-hmm. Yeah, so currently the three authorized vaccines offer protection against variants as well as we call the wild type, the initial coronavirus before it started mutating. It covers all of those, and even if there is some slightly decreased protection from with the variants, it still offers substantial protection such that it will sort of decrease the likelihood of virus being spread from person to person. And so it'll be much faster that we actually achieve, for instance, herd immunity. So folks should definitely get the vaccination if it's offered to them and if it's something they feel like is a good fit for them.
Thank you. I'm going to come back to you a little later with some more questions. I want to switch gears again. My next question is for Gabriel. Gabriel, you and I have been on the front lines of HIV prevention for years. The work that you do is vital, and your work is rooted in communities of color. But we have a question from Johnson from North Carolina. And Johnson asks, what can you tell me as a person of color that will ease my fears about the vaccine?
You know, that is honestly a very layered question. I have a layered answer for it. I recognize that fears cannot be eased without trust. And, trust for me, at least, begins with relationships. And so, I also hear a lot of talk about vaccine hesitancy and associating vaccine hesitancy with Black people. And I just want to make it very clear that, Black people are not hesitant about science. Okay, Black people are not hesitant about science. We have pioneered, created, and driven and manifested much of the scientific revolutions in this country, including have worked on the COVID vaccine. And I think for me, individually, who has had allergic reactions to medication, has had side effects from past vaccinations, I recognize that in my choice to get the vaccine, and I have been vaccinated both doses, 2 weeks post both doses. And that came from the relationships that I have with the many physicians, Black physicians, advocates, NIH researchers, my local institutions, people that are in science who actually not only are interpreting for me the science, but actually played a role in its development. And I think that's the one thing that I hope all Black people take away, is that at the highest and uppermost echelons of the development of this vaccine, there were Black people involved. And many of us on this panel know many of them who were involved. And so you have to sort of build trust with your own people. And reaching out to those who are in your community who you do trust. And everyone has them, whether it's your local college of medicine, whether it's your own physician, is building relationships allows you to better trust the science and trust us as institutions when we ask you to take a vaccine. And I do recognize that much of the hesitancy is really hesitancy in trust of the system and hesitancy in trust in its leadership. And so, one of the ways that I get around that is by building new relationships with those that I trust who are in positions of science to tell me really what the facts are, like Dr. Blackstock here.
Thank you for that. I mean, I think you could have said it even better. It's all about building that trust with community. So building upon that, what Gabriel just shared, I think the next question is probably best for Dr. Blackstock. So how do we address the inequalities in the healthcare system that have led to generations of inequitable health outcomes for Black and Brown people?
Well, yeah, so that's a really big question. So just to say, a lot of the inequities that we are seeing, obviously, this pandemic are a result of entrenched systems of oppression which have existed in this country for centuries. But this pandemic has just sort of worsened things. And I think, just thinking about the healthcare system, for instance, the entry point to the healthcare system many times is having health insurance. And we know that Black and Brown people are disproportionately more likely to not have health insurance. And that's, linked in part to the fact that health insurance in this country is often employment based, and that we have, occupational segregation that has really resulted in concentrating many Black and Brown folks in low paying jobs that have either no benefits or limited benefits, such as health insurance. We know that many Black and Brown folks were more likely to lose their jobs during this pandemic. Again, losing health insurance and that access to healthcare. And then, there is data that shows that, when I think Black people in particular went to go get tested, particularly at the beginning of the pandemic, many were turned away. And that sort of weights disproportionate to their white counterparts. And then we think about the care that people are able to get in their communities over the last few decades. We've seen, closure of many safety net hospitals, as well as community hospitals in many parts of the country. And so we have many Black and brown communities that don't have or have very few ICU beds. And we know that was tied to sort of how well people who were hospitalized with COVID-19 did. So there are lots of things that need to be fixed. I mean, I think one of the issues, just thinking about the healthcare system, is really, healthcare for all, for instance. I mean, making sure that all Americans, have access to comprehensive healthcare that is going to be, it's not a, complete solution at all, but it's one of many, of a multi-pronged approach. But really, I mean, there's so much is tied to health. And I think so much of what Gabe was saying, just in terms of, housing and employment, and there's just so many things that affect health, not just the healthcare system, that we really need to think about. And I'm hoping that this is really then, a wake-up call, and that we can use some of the momentum that we saw, in the spring with some of the social uprisings that we saw after the murder of George Floyd, to really think about how we can make meaningful change happen. So I don't have all the answers, but basically we need to sort of make the cake again. The cake is really messed up, and we need to make a new cake.
And to underscore one of the points you made, if we want to be intentional about changing the health outcomes of Black and brown communities, we must first look at addressing the social and structural determinants of health, right? That prevent people from accessing care and having those positive health outcomes. Thank you for that, Dr. Blackstock. My next question is for Dr. Cates, and it's from Donna from Georgia. Like many of us, she has a question around herd immunity. And the question is, or what we want you to be able to do, or if you can do for us, is share a little more about what herd immunity is and how do we reach it?
Sure. Good question. I think we heard a little bit of it earlier. It's the idea that with infectious disease, as enough people become immune to the disease, either because they've had it or because they're vaccinated, that really diminishes over time the number of people who are susceptible to getting sick. And so in the context of COVID, what we're trying to achieve is, and vaccination is usually a better way to get immunity than getting sick from something. And there's also, you're not getting sick. So the idea here is that if we can get enough of the population vaccinated, we can get to a certain point where so few people are susceptible to getting sick from COVID that we really provide the pathogen with very few options. It's not going to be able to mutate. It's not going to be able to travel around because so few people are susceptible. And I think that's just in broad strokes what the idea of herd immunity is. It's a little bit hard to know exactly what that point is going to be. And we're going to have to keep watching all these statistics that we've gotten kind of used to. How many people are getting vaccinated? Are cases still going down? Are hospitalizations still going down? The things that we've all over the last year have had to watch, we'll still need to watch those. But there's really good information coming out of other countries that are vaccinating ahead of us, where we're starting to see that beginning of that effect. So that's why it's so critical that everybody gets vaccinated, or if they can, when they're offered.
Thank you for answering that. That was a really big question in our community. Most people had no idea what herd immunity is. We just continue to hear it over and over. I have another question for you. And this question focuses more on access. And the question is, why are people having such a difficult time figuring out how to access the vaccine?
Yeah, this is something that we've studied a lot, and we continue to look at it. And I think there's a few issues here. One is that the supply of the vaccine has not been sufficient yet. It's changing, and people have probably heard the president has made that announcement again and again, especially today, saying there's now enough vaccine to vaccinate everybody who needs to be vaccinated in the US by sometime in May, which is phenomenal and really a great accomplishment. But up until then, the supply is not enough to meet the demand. In addition, the system that we have in the United States, which is often what happens with our public health, and it's not great for a pandemic, is that all of the decisions are localized and being made by every state. And so somebody living in one state might be eligible for vaccination today, whereas somebody living in another state who is exactly in the same situation is not eligible. That's created incredible confusion, frustration, people feeling like they don't know when their turn is going to come, and also not even understanding or being able to get the information in their state. Some of the websites aren't very clear. Mm-hmm. Some people are, we hear stories of people having to be on, having multiple browsers open, or being able to take time away from maybe work to call. This is not a way to get a vaccine out to people. So that's happening everywhere. So if anybody's listening and feeling frustrated, know that you're not alone. The good news is that in addition to supply really ramping up, states are now, because of that, are moving much faster in their opening up of eligibility. And just before this call, I counted 26 states have announced that they're opening up vaccine eligibility to everybody 16 and over in the next few weeks. So some of the challenges that we've all been hearing about will diminish. I will say, though, that even when that happens, I think some of the issues that Dr. Blackstock talked about, we'll have to double down on making sure that equity is achieved. Just because vaccine eligibility is going to be open to everybody doesn't mean everybody's equally going to be able to get that vaccine. So it will help us and help everybody, I think, in not having to wonder when their turn is, but there's still going to be some barriers. And I think, that's something to pay close attention to.
Thank you for that. I'm going to circle back to Dr. Blackstock now. I have 3 more questions for you. And my first question from a member is, as a trans person, are there any special considerations I should be aware of when considering whether or not to get vaccinated? And will the vaccine interact with my HRT or impact my medical transition?
Right. No, this is such an important question, and I know could, impact someone's decision to ultimately get the vaccine. I think some of the challenges that we don't have, there's a lack of data from the clinical trials in terms of sexual orientation, gender identity data, in terms of how the vaccine performed among different groups of folks, including people who are transgender, as well as folks who might be taking gender affirming hormone therapy. So what I'm thinking, what will probably happen is we'll see, for instance, like large healthcare systems or clinics, places that already collect some of this data, maybe able to give some more definitive answers, or looking at administrative data from like maybe insurance plans or something like that, where we can sort of dig down at to see whether there might be any concerns. But I would have to say that just based on the mechanism of action of the vaccines, there's nothing to suggest that there should be any interaction with gender affirming hormone therapy. I will say that the CDC has this app called VSafe, where people can, like after they have the vaccination, they can report, side effects or experiences they're having. And this is like a really missed opportunity, because I think when they ask about like gender identity, they just ask for like male, it's like male, female, or other, and then they don't ask about like other medications or gender affirming hormone therapy. So it would be really great to have that, updated, so we can start collecting some information that would be helpful as people decide whether this is something for them. But as I said, there's nothing to suggest that there would be any potential interactions or any concerns for people who are transgender or people who are taking gender affirming hormone therapy.
Thank you for that. The second question is, if I get the vaccine, what do I need to do to remain safe and keep my family and my friends and my community safe?
Yeah. So, there's some interim guidance that was released by the CDC, I think a week or 2 ago, for folks, just to provide more guidance on, now that people are vaccinated, how does that change things? And so the recommendations are that it's okay for folks who are vaccinated to come together in small groups indoors without masking, without social distancing, and also for folks who are vaccinated to socialize with people who are unvaccinated, who are living in a single household, without wearing masks or social distancing. And then obviously there's no need now to quarantine or to get tested if one has been exposed and they've been vaccinated, unless they're having symptoms. In that case, they should be tested and obviously quarantine. So those are some of the things that, people can do. And hopefully, as time goes by and more people get vaccinated, we'll start seeing, additional guidance that allows some, not necessarily return to normalcy, but allows us to like engage in some of the activities that we were able to do before the pandemic.
Thank you for that. So our last question for you is, would you well, the last question is, the person said, I would like to expand my family in the future. However, I am concerned about the impact of the vaccine on my ability to conceive and or carry. Should I get vaccinated?
Right. Yeah. So, pregnant people were, not were excluded from the clinical trials. Of course, people became pregnant during the vaccine clinical trials, and those folks are being followed by the vaccine makers just to see whether, how they're doing. The recommendation from the CDC is that, individuals speak with their provider and do shared decision making. So figuring out, once you provided the person with information and understand what their values and preferences are together with your provider, decide whether this is something for you. Again, there is nothing about any of the vaccines to suggest that they would be dangerous for anyone who is trying to conceive, who is pregnant, who is lactating. There are also there are studies that are underway that are enrolling people who are pregnant. So we'll get more and more data. And then also, before the vaccines were ultimately authorized, they were tested in sort of animal models, and there were no issues found in those as well. So as time goes on, we're getting more and more data, but the information that we have so far suggests that it is safe for folks to get the vaccine if they're pregnant, lactating, or wanting to conceive.
Thank you for that. Appreciate it, Dr. Blackstock. Sure. Gabriel, so we've received dozens of questions about the cost of the vaccine. What is the cost of getting the vaccine?
Well, the vaccine is free. And I think, although I kind of smile and chuckle a little bit at my answer, it really is a serious statement because particularly when there is a crisis, we know that there are a whole bunch of snake oil salesmen out there who use a variety of taking advantage of vulnerable and unaware people. So if anyone is trying to charge you for the vaccine, then you need to question that immediately. And I would immediately contact your local Department of Public Health. So the vaccine is free. However, Jen referred earlier to, the whole host of barriers from that do have a cost, from transportation to childcare to time off of work. And, people who come from poor, disadvantaged, or marginalized, or limited or restricted backgrounds or experiences, are going to have to, it will be a burden and it will be a barrier for them to be able to get out of their job or make their way to their nearest clinic. And particularly for rural regions, that distance to take off to get to the clinic could, at least in the county I serve, it could be up to 2 to 3 hours on public transportation, depending on where you're going and coming from where. Right. And so, I think that is a real factor that, sometimes privileged people do not consider within their periphery, and understanding that, accessing care and treatment, regardless if it's a COVID vaccine or a primary care visit or your HIV appointment, whatever it may be, that there's, often challenges from those who are, have less means and access.
Thank you for that. Gabe, my next question is for you as well. You and I know that from our HIV work that IDs sometimes present barriers to care, right? We've also received questions asking if a person needs an ID to get a vaccine. How would you respond to that?
So, depending on how you look at it, fortunately, unfortunately, in both cases, local jurisdictions, states set a lot of their own guidelines and guidances. I am a big supporter of the FQHCs in this country, and I do know that there are FQHCs in multiple states all across the U.S. who are playing a meaningful and central pillar to vaccine inoculation in this country. And so I know that for those entities, they are reducing barriers and they work with populations that often don't have access to IDs. So first and foremost, try and look for an institution that is making way for your population, a place that may be safe for those who are of undocumented immigration status, or a safe place that you already know is a clinical institution for those that are of the transgender experience. I think that is important for first and foremost. And then I think secondly, being aware that depending on what the guidance is or the protocol is for your local jurisdiction, there's a whole host of identifications that you can use. You could use your student ID. You can use a military ID. You could use a library card. You might even be able to use a utility bill if the local jurisdiction doesn't require a picture on it. There may be a whole host of things to show residence, to show where your location is. And I think one of the main reasons that they may ask for a form of ID is because the dissemination of the vaccines is being done by county. So a lot of counties are very particular on serving their population, their residents that are in their locale, and not taking people from outside. So there could be even allowance for like a utility bill, right? I can't say for certain because each jurisdiction is different, but I'm going to go back to my first recommendation, and that's really to try and identify the existing clinical and medical institutions that are already in your local communities that are known for working with populations that may otherwise not have access to a government form of ID.
Thank you for that. Thank you for that. Dr. Cates, as you know, March is BIPLUS Health Awareness Month, and there are several questions about the barriers, the unique barriers actually, that BIPLUS people face in the healthcare system. In fact, our own research here at HRC shows us that BIPLUS individuals are more hesitant to get vaccinated than LGBTQ people broadly or the general population. Could you share a bit more on the BIPLUS health?
Yeah, great question. I think one of the big challenges is that there's just not enough research. There's not enough data that's available to give us all the information we need about why people who identify as bi are having more negative experiences in some healthcare environments or more reluctant to get vaccinated. And I think it really just we know that there's barriers. We know from studies such as yours and others we've looked at. There's more barriers to access to care, sometimes with insurance. With the way they're experiencing healthcare providers, but there's just not enough data to really help guide us further. So I think it really comes down to making sure that we are going forward, that we're all collecting information and trying to understand the experience further and what can help and make people who are self-identified as bi understand vaccination, understand why it's important. And that's just a critical agenda item for all of us. And I also, can I just add one more thing to the question you asked, Gabriel, just about identification and challenges with that. In general, it's true. States and counties may ask for identification. It's usually because of residency requirements. For the most part, people should not be turned away from being vaccinated. And in fact, undocumented individuals are not to be turned away from vaccination in this country. And so that doesn't mean people won't have experiences where they might, but I think it's really important. Everybody knows that the federal government, the Biden administration has said that the vaccine is available to everybody. Not your citizenship status does not matter in terms of vaccine access. And as Gabriel said, there's going to be sites that are more friendly and open and understand this, but everybody should know that they have a right to get vaccinated. Thanks.
Thank you, Gabriel, and thank you, Dr. Cates, for putting such a fine point on that. So, sadly, we have to wrap the panel discussion here. But in closing, as of today, March 18th, 2021, more than 100 million vaccination shots have been administered, and more than 1 in 10 people in the United States have been fully vaccinated, and more than 2 million shots are being delivered daily. Thanks to the work of the people on this call and listening and watching us today. I want to personally thank you all for joining us tonight, and I want to thank you for keeping our community safe. And now I want to turn things back over to HRC's President Alphonso David to welcome Dr. Anthony Fauci to the conversation.
Hello again, everyone. You've already heard from several doctors and experts about the COVID pandemic and its impact on our communities. Now, we will hear from Dr. Anthony Fauci. Dr. Fauci was appointed director of the National Institute of Allergies and Infectious Diseases in 1984. He oversees an extensive research portfolio of basic and applied research to prevent, diagnose, and treat established infectious conditions, such as HIV/AIDS, respiratory infections, and other established and emerging conditions. Dr. Fauci has advised 7 United States presidents on HIV/AIDS and many other domestic and global health issues. Nearly 20 years ago, He was one of the principal architects of the President's Emergency Plan for AIDS Relief, a program that has saved millions of lives throughout the developing world. Dr. Fauci, thank you for joining the members and supporters of the Human Rights Campaign for this community town hall.
Thank you for having me. I appreciate it.
You're welcome. So let's begin. Dr. Fauci, over the past year, you have become a household name for almost everybody. But those in our community who are on the front lines of responding to the AIDS epidemic, you have been a trusted friend and a resource. Advocates have commended you for listening and learning from our community. They've also given you credit for getting the federal research apparatus to incorporate recommendations from the frontline advocates who are responding to the epidemic. How has that experience guided your approach to the current pandemic?
Well, what it established in me a long time ago, as you mentioned correctly, almost 40 years ago, was the importance of reaching out to the community who is involved in whatever particular outbreak you're dealing with, to learn from them the things that are important in how you can address the outbreak. This has been particularly important in the disparity of disease burden, hospitalizations, and death that we're seeing in people of color with COVID in the United States, where the disparity of not only incidence of infection, but also the possibility and likelihood that people of color, because of their underlying medical conditions, would actually suffer a greater burden of disease and death. So that experience in making sure you're in touch with the constituents who are involved in the disease is something that's an important part of my approach to any disease, particularly a new and emerging pandemic like we're dealing with now, very similar to the beginning of the pandemic that we experienced with HIV in the early 80s.
So you've mentioned the disproportionate impact that HIV/AIDS had on Black and Brown communities, and we certainly see here as the COVID pandemic wore on, the data now confirms that Black and Brown people were disproportionately dying as a result of the virus. You've alluded to this, but maybe we can talk about this more directly. Was this predictable, and what accounts for that disparity?
You know, it is predictable if you look at the facts that are on the ground. First of all, as a group, as a demographic group, Brown and Black people are more out in the front lines in what we call essential jobs, which puts them into person-to-person contact. And whenever you have a respiratory-borne virus, particularly one that so efficiently spreads from human to human, right away they're at a greater risk. Once they get infected, again, as a demographic group, if you look at the underlying conditions that predict and prognosticate whether or not you're going to get seriously ill with hospitalizations and deaths, the prevalence and incidence of these conditions clearly are disproportionately greater in the Brown and Black population. I refer to diabetes, hypertension, obesity, chronic lung disease, kidney disease, and other conditions. So if you just look at that, you could have predicted that. Some of the things you can look at and do something about immediately, like making sure testing and access to health care is more equitably distributed to Brown and Black people. But the long-range plan about this is much more problematic, and that is that Brown and Black people who have these underlying conditions have them because of the decades-long social determinants of health that started off literally from the time that people are born to the time they become adults. And those are the things that hopefully, when we get this behind us, we'll have the corporate memory that will really stimulate us, to use that word, to make a decades-long commitment to address these social determinants of health that have put Brown and Black people at such a disadvantage. So when we look back at this experience, let's not forget the commitment that we should have to address these disparities.
Now, we're talking about looking back at this experience, which I assume you mean we're looking forward to vaccines and we're looking forward to protecting ourselves from COVID moving forward. Some people in our community are concerned about the speed with which the current vaccines were developed and approved, especially given that we still do not have an HIV vaccine 40 years after the virus was first discovered. How do you, I should say, respond to concerns about the speed of developing a vaccine in this case?
Well, it's an excellent question that gets asked frequently. Let's take the difference, the fundamental difference between SARS-CoV-2 and HIV. In the field of vaccinology, one of the tenets that we hold is that if you want to make a successful vaccine, you mimic natural infection. And we know even with the great killers and maimers of smallpox, polio, measles, even though a substantial proportion of individuals can get very ill and many die, at the end of the day, the human body is very capable of ridding from itself smallpox, polio, and measles, leaving you with lifelong protection against infection from the same virus, which means the body has given you a proof of concept that it is capable of making an adequate immune response against all of these other infections. So that's the reason why we have effective vaccines against smallpox, measles, polio. That's not the case with HIV, because as we know, for reasons that are still not entirely understood, the body does not make an adequate immune response against HIV, which is the reason why virtually nobody spontaneously recovers. We have long-term survivors, we have elite controllers, but we don't have people who get rid of the virus on their own. It's very similar with SARS-CoV-2. Even though it's a very serious infection, most of the people recover and they clear the virus from the body. So the idea that we have a vaccine for SARS-CoV-2, but we don't for HIV, is purely explainable on scientific principles. Now, getting back to your real original question is, how could it be that we did it so quickly? The speed of getting a vaccine literally in less than a year from the time you discover the new virus to the time you have an efficacious doses of vaccine that you're putting into people's arms is merely a reflection of the spectacular advances in scientific platform technology that relates to vaccines, as well as the immunogen design. These things didn't start in January of 2020. They have been going on literally for decades before. So we got to make sure people understand and rest assured that the speed did not compromise safety, nor did it compromise scientific integrity. It is merely a reflection of scientific advances.
As I listen to that response, Dr. Fauci, I think about members of our community, specifically those who are Black and brown, who have reasons for distrusting the medical system. So the medical community, as you know, has had an extensive history of performing unwanted medical procedures on LGBTQ people, such as electric shock therapy, or denying necessary medical care outright, like transgender affirming care. Also, many people fear being discriminated against or profiled by medical staff once specific information, including their HIV status or their gender identity, is revealed. So what do you say to them and others about the safety of the vaccine? We talked about the speed at which the vaccines have been created, but what do you say to them about the safety of taking these vaccines?
Well, before I get into the safety of the vaccines, I always have a great deal of respect for the hesitancy of people who historically have a good reason to really question. And you mentioned some of the egregious violations of ethical principles that the medical profession historically, to brown and Black people and to LGBTQ people, going all the way back to the infamous Tuskegee experiments. So you don't just blow off the concern. You say, I understand your concern, and that's not something that I'm going to push back on, but let me explain to you why we feel it is safe. And then you just go through the facts. And the facts are that, for example, the 3 vaccines that we're talking about that have already been given an experimental and emergency use authorization from the FDA, the Pfizer, Moderna, and J&J. In the Pfizer study, there were 44,000 people in the trial. In the Moderna, there were 30,000. In the J&J, there were 40,000. So you're talking about over 100,000 people were in clinical trials, and there were essentially no adverse events that were severe that could be determined to be caused by the vaccine. The safety profile was really quite good. You will always get adverse events in any intervention, but they were extremely rare, and the risk benefit of getting a vaccine versus COVID far weighs in favor of the benefit.
You mentioned the 3 vaccines, the 3 approved vaccines. I've actually gotten this question as well. Should folks be worried about which one they get? Is there a preference? Is there something they should be considering as it relates to their status, whether someone who has HIV, or if we're talking about members of our senior community? Now that we have these 3 vaccines, should folks be worried about which one they get?
The answer is no, because these are 3 highly efficacious vaccines, not only to prevent mild to moderate disease, but extremely effective in preventing hospitalization and death. If you want to compare one to the other, you would have to do a head-to-head comparison with a common placebo group, and that was not done. So any differences in percentage of efficacy that people refer to is really not an appropriate comparison, because they weren't compared head-to-head. What we can say with confidence is that we have 3 highly efficacious vaccines. So when asked the question, how would you approach getting vaccinated? I would go to a place that is open to me and see what they have. And I would take the vaccine that was the most immediately available to me, because the quicker you get vaccinated, the better off you are, regardless of which of the 3 you take.
The Centers for Disease Control recently put out guidance that prioritizes people living with HIV for vaccination. What guidance do you have for people living with HIV about staying safe during this pandemic?
Well, it's exactly the same as what we tell other people. There are 4 or 5 fundamental things that we can do. 1, uniform wearing of masks. 2, keep physical distance. 3, avoid congregate settings, particularly indoors. And 4, wash your hands as frequently as you possibly can. This is a respiratory-borne virus, and those types of interventions definitely work.
And I have a final question for you, Dr. Fauci. What keeps you optimistic?
Well, what keeps me optimistic is, the spirit of the American public. Unfortunately, we're living in an era of a lot of divisiveness, but I think deep down that we always come through and pull together under very difficult circumstances. The other thing that keeps me optimistic is the power of biomedical research and science, which has given us vaccines in absolutely record time. So it's a combination of faith in the people and faith in the science.
Dr. Anthony Fauci, thank you so much for joining us. Thank you for helping us stay safe. And thank you for helping lead us through this pandemic.
Thank you for having me. It's a pleasure. Take care.
Take care. I also want to thank everyone who joined us tonight. You can visit hrc.org for more information about the vaccine and COVID resources. You can also find out more about how you can help support your community and get involved in our work to advance equality for all. We must continue to stay safe. By taking care of ourselves and each other, we will get through this together. Have a great night.